exciting to see the number of people joining the webinar this morning. I'm Phil Fisher. I'm the director of the Center for Translational Neuroscience, and we are extremely pleased to be sharing some time with everybody. We know that everybody has been engaged in plenty of Zoom webinars, and so we're especially pleased to see that people were willing to carve out 3 hours on their schedule to hear from our illustrious presenters that will be sharing various perspectives with you today. I am going to jump in and just do a brief kind of overview and setting the stage for what we're going to be talking about today, and then I'll pass the baton to one of my colleagues, Tyson Barker, who's been leading a lot of this work. And our slides are being advanced remotely by one person, so all of us will be asking for the slides to be advanced as part of the webinar. So let's go ahead and go to the next slide. So first of all, I wanted to begin by acknowledging the funders who've been supporting this work. These ideas came about several years ago in the context of what was then and has continued to be some very robust conversations about issues of measurement of impact in the field of early childhood. There is a lot of interest in the issue of measurement in early childhood. There's also a fair amount of support of measurement efforts by philanthropic foundations, but this group in particular, Pritzker Children's Initiative, Heising Simons Foundation, the Overdeck Family Foundation, and the Valhalla Charitable Foundation have really been champions of the perspective that we've been promoting, which you'll be hearing about over the course of today. So our sincere gratitude to them and program officers from those foundations who've been working closely with us on this project. Let's move to actually, we can just stay here because my remarks are actually going to just be more extemporaneous. What I wanted to say was that if you go back 10 years ago, let's just say, who would have imagined at that time, maybe a few would have, but who would have imagined the space that early childhood has come to occupy kind of in the ecosystem of just efforts to promote well-being across the lifespan. It's hard to imagine that at that time we could have envisioned the extent to which things like the understanding of the early years and how critical they are for brain development and how experiences shape brain and biological development and health, as well as emotional development and learning across the lifespan, how much public understanding and policy decisions are being driven by that knowledge that's been spread. How much there is an understanding that supporting early childhood can really make a difference and deliver major returns on investments, perhaps the biggest returns on investments. I think 10 years ago, those ideas were starting to begin to rise in the landscape, but it was still very early days. And what we've seen over the course of time is that those concepts and those issues have become more and more part of the public narrative about how we can most effectively support all humans, all children, all families to have the most optimal outcomes, even in the context of significant challenges, structural inequalities, institutional racism, and other issues that have really become clear that we need to be addressing. I also think that it's particularly noteworthy that even in the context of a global pandemic and the pandemic that's affecting this country, that early childhood remains ascendant, that there are many voices, not just ours, but I'm sure from many who have joined this call, who continue to emphasize that if we don't attend to the early years, that we're going to be paying the price from the pandemic for decades to come. In other words, the pandemic hasn't really done anything to take away from our understanding of the needs of early childhood and the importance of early childhood. The challenge that we face, I think, is that in that context, with all of this recognition, all of the conversations that we have had with funders, with fellow researchers, with policymakers, with child advocates have really often had sort of, they start in many places, but they all end up converging around the issue of measurement. That is to say, that even if you're emphasizing and funding and resourcing early childhood, at the end of the day, if you can't measure impacts effectively, then you're really basically where we've been for the past 50 years of not really knowing what we can do to produce the kind of breakthrough outcomes and impacts that we really need to do in the field. So measurement, and in particular measurement of impact in the context of programs to support children and families, is really, from our perspective, kind of the holy grail of what we need to get to. And what you're going to be hearing about today is, just imagine a world in which it's possible, not just for researchers from well-funded academic programs, but for anybody who's interested in promoting and measuring impact of anything that would be done to support children and families, to be able to access tools to easily be able to measure the impacts of what are being done. Imagine the possibility that that information is widely available, is open access, and comes attached to it with the kind of technical assistance that can help really design effective measurement and evaluation strategies, so that anybody, whether they're based in a university setting, whether they're based in a community organization, whether they're trying to develop new ideas and programs, that anybody has access to these tools to be able to engage effectively in measurement and evaluation. That's really what we're at the table to talk to you about today. We've been designing these tools over the last couple of years, and over the next month and a half, we're getting ready to launch one of the primary tools, which is a repository of measures in early childhood that we plan to make available to the field and to anybody who's interested in it, that will help guide people in the selection of measures that can really be much more precise in terms of what it is that people think they want to change and how they're going to go about changing those things and whether they're actually succeeding in doing so. The design of the tool, the Impact Repository, has taken lessons from many others in the field that have existed, not only in early childhood, but elsewhere, but is really unique in many capacities in terms of its usability, its accessibility, and in terms of the basic architecture of it, which is designed to allow it to grow, to not only document what's out there, but to stimulate and provide resources for those who are interested in developing new measures, in pushing the envelope in terms of how we think about what it is that we might be trying to change and how we go about trying to change those things. Everything from screening measures to program evaluation measures to even population-based measures. So we see this as a starting point, and we're extremely excited to be on the launch pad and to basically be starting the countdown to when the impact tool will be launched, which will be later, early in 2021. And what we encourage you to do now is to sit back and listen. You'll hear first about a brief description of what the impact tool is going to look like. And then you'll be hearing perspectives from some of the luminaries in the early childhood field who know most about these issues and who are going to share their perspectives about where we are and what we need that will hopefully help to shape the ongoing early childhood field when it comes to measurement and evaluation. So I'm now going to pass the baton to my colleague Tyson Barker, who, as I said, has been instrumentally involved in developing this from the get-go, and who I'm sure you will be in good hands as he's teeing up what the Impact Repository will be looking like.
Yes, thank you, Phil. As Phil mentioned, in the past year, we've been working on developing the Impact Measures tool. And just quickly, my name is Tyson Barker, and I am a director of the EC Prism program at the Center for Translational Neuroscience at the University of Oregon. Feel free to go on to the next slide. And what I'll do very briefly is just give you a sneak peek at some of the features of the tool as we are entering some of the final development stages. So the impact measures tool, as Phil mentioned, is a repository or a database of early childhood and parenting measures. And the idea is you will be able to search, compare, access measures scored on 4 key categories, in which I'll discuss very briefly. One of the main ideas behind the tool is that users will be able to find high quality measures that work for various communities and contexts, as well as we have dedicated sections about learning about measurement and evaluation via educational videos and content. Next slide, please. So the impact scoring system, one of the areas in which we've spent the most time developing is what we're calling the scoring diamond, which is used to determine how well a measure scores in 4 key categories. Briefly, those 4 key categories are usability, cost, technical merit, and cultural relevance. The idea behind the tool is that users will be able to set their preferences for the desired minimum score in each of the 4 categories. And what we learned is through our experience working with our early childhood programs that we understand there's different needs and priorities for measures. So those 4 key categories were distilled down based on our experience, as well as surveying those who we've worked with within the field in the past few years. So as I mentioned, one of the key features of the impact measures tool is the ability to search and compare measures. You'll be able to not only use a variety of filters to find those measures based on various areas of early child development, but also search measures based on your preferences that you've identified, and measures would then be sorted accordingly. Next slide, please. In addition, as I mentioned, we'll have short video snippets about measurement and evaluation that describes very small areas and aspects that we often find within our technical assistance work that are critical in the use of measures and measurement tools, as well as evaluation. We'll also have educational content, written content as well, and frequently asked questions sections to help users better understand the best way to use the tool for their measurement purpose. Great. Well, that was just a short preview, and what we'll now do is move in to our first keynote speaker, Portia Kennel. Portia is Senior Advisor of the Buffett Early Childhood Fund, and prior she was Senior Vice President of Program Innovation at Start Early, which is formerly Ounce of Prevention, as well as the Founding Executive Director of Educare Learning. And in her current role, Portia leads efforts to develop family engagement program models that empower parents as a force of change in families, schools, and communities. Portia has over 25 years of experience developing, implementing, and scaling effective evidence-based early childhood programs, home visiting and family support models for children and families. And why we asked Portia to speak today, through her work as an administrator, she's been influenced by measurement throughout her career, and she brings a really unique perspective in early childhood measurement. And as a side note, it took some convincing to get her to present. When I first mentioned I wanted her to present, she said, "I'm not a measurement expert, why are you asking me?" But it took a little coaxing, and I do truly believe that her expertise and the use of measurement in the field and the way it is used within systems by administrators, by practitioners, it paints a very unique picture that I think is important for our tool as well as for the field of early childhood. So thank you, Portia, for accepting after a little coaxing. Portia's presentation is Rethinking Measurement in Early Childhood, What Matters.
Thank you, Tyson. It took a little bit of coaching, but I'm glad I'm here. Hello, everyone out there in virtual land. Good morning or good afternoon, depending on where you are geographically. Listen, I want to thank the University of Oregon, Phil Fisher, and the Center for Translational Neuroscience, and Tyson Barker and the EC Prism Group and their teams for giving me this opportunity to speak to you today. So let's get at it. First of all, I want to set a little bit of context for my remarks today. I was asked to share perspectives of program practitioners in early childhood, to bring the perspective of program leaders, practitioners, and other helpers into this virtual room. To that end, I will be sharing key takeaways from conducting focused interviews about measurement with a number of early childhood leaders across the country. But before I do that, I have to say this every time I'm asked to say a few words. I would be remiss if I did not acknowledge the current state that program leaders and staff and families find themselves in, specifically the impact of the pandemic and the hardship that continues to be present in programs and staff and families and communities. And especially the hardship that's been caused in low-income communities that are underserved, under-resourced. These have been difficult times, and that is the context right now in which program practitioners, leaders, helpers are continuing to outreach to families and children. They're on the front lines, and while there have been disruptions in services from time to time, for the most part, staff have continued to reach out to families and children. Staff have been what I call the constant disruptors of the cycle of distress that has been caused by the pandemic. So I wanted to lay that out there because that is the context in which we are operating right now, all of us. So let's talk about what I'm going to do today. First of all, I'm going to share information about the current state, the role and impact of measurement in early childhood programs as seen through the eyes and experiences of a group of early childhood program leaders as they reflected on their collective experiences, and I reflected on mine too. And I want to share that information with you, and I want to leave you with some key challenges to consider as we, practitioners, researchers, funders, policymakers, families, and community stakeholders collaborate together to rethink early childhood measurement going forward. Okay, so next slide. So I'm calling this section Conversations from the Field. In other words, voices from the field. These are the voices of the executives and program leaders that I interviewed. So the question is, who are these program leaders? Who are they? Let's say these were over 14 program leaders in early childhood, the majority of which were members of the Educare Learning Network who operate Educare Schools, which is a birth to 5 high quality center-based programs, although some of our programs also do home visiting. These were rich conversations, but I'm going to focus on the key takeaways for this presentation. But the leaders and program executives had a lot to say. And the Educare schools across the country, it numbered 25. Last year, they served over 3,500 children. And this year, we're not only talking to those leaders, but some other leaders outside of our network who, in addition to Educare schools, are members and provide early Head Start childcare partnerships. So in addition to the 3,500 children that we touch within the network, there are hundreds of other birth to 3 children in which early childhood program leaders are partnering with community-based centers and family childcare homes. So just to give you a little slip of understanding about who I'm speaking about and who they represent. The field is a large field, but I think that what I have to say will resonate and give us something to think about in terms of no matter what the setting is, the early childhood setting is, there are some things here too that we might want to carry forward. So let's begin with where we are now. So where are we now? Next slide, please. Now, to begin this section, I'm going to begin with what I call, I guess they call in Reggio Emilia, a provocation. So I'm going to begin with this quote that's been adopted. It's a quote from Albert Einstein, but Portia took the liberty of tweaking it a little bit so it would be appropriate for this situation. So what the quote says, and I want us to think with me as we talk the rest of my time, what matters cannot always be measured, and what can be measured cannot always matter, does not always matter. Now, Albert said that what matters cannot always be counted, but I put measured in there. So what matters cannot always be counted, and what can be measured does not always matter. I want us to sit with that a little bit, because therein lies our dilemma as practitioners, as researchers, as other stakeholders face the creation of measures that matter and deciding what really matters. We're going to have to collaborate and work together to determine what matters most to support children's development and learning. And program leaders expressed a desire to have a better understanding of what matters and what measures work for whom and within what context. So, with that said, next slide, please. In the ideal world of if what is working now, what am I talking about? What are the leaders saying about this? And basically, they're saying that it was unanimous across all of the leaders that I spoke to that measurement is an essential tool and provides concrete evidence of the impact of their programs and their services. It helps them maintain quality, it helps them achieve outcomes, and it's a critical component of their continuous improvement process. Measurement and program evaluation is the way in which leaders are able to tell their story about the impact of their program and services on the children and families that they serve. It's an essential component of their work. They're with us right now, this is how it is, and we've come a long way in embracing measurement. It helps leaders make program decisions that hopefully increase the success of their programs in terms of the impact and outcomes. It drives their continuous improvement process and allows the practitioners, hear this part, to feel validated regarding the work that they're doing with children and families. Because we had a feeling and we knew something was going on, and measurement helps give description and words to describe what we're experiencing in our programs with children and families. Next slide. Oh, I'm sorry. This back one more. It should be, okay, right. Thank you. Thank you. What else is working? Measurement has supported high quality teaching practices. It has provided specific information regarding the areas of improvement for specific teachers. It focuses on practices that address specific challenges children are facing. So in other words, it's contributed to deliberate decision-making about the professional development of teachers too, because they've been able to identify what practices work with what children and under what circumstances. and it allows programs and staff to place more intentional and deliberate emphasis on practices that focuses on different challenges that children are facing. And this is really, really critical. I think the other thing I want to emphasize that the leader said was that they really would like more professional development collaboration with researchers to help explain what measurement means in the context of their program. Sometimes program staff have a difficult time making the connection. Okay, we got a measurement, we've got observations, we've got all of these things and parents' perspective. How does it all fit into a coherent understanding of what's happening in the growth and development and learning of a child? So and sometimes teachers are disconnected from those measures. They're like, what does that have to do with what I'm doing in the classroom? Can somebody build a bridge from that measurement result to what is actually happening in the classroom? And that's one good thing about the EC Prison Group. They're going to help practitioners like me and others make that connection. So that's in the current state. That's what the leaders have shared with me is working well. And when measurement works, all of these things are happening at once in a program. So let's talk about the next slide, which is, where do we go from here? If this is the foundational things that we heard from the voices in the field about how measurement has impacted their program, if these are the areas in which they have been impacted and in which they are in consensus about, have added value, meaning, and specificity and rigor to their programs, where do we go from here? Well, once again, I want to go to a quote. I want to have a provocation here. Stay with me now. Here is the quote. Next slide, please. A system of education is not one thing, nor does it have a single definite object, nor is it a mere matter of schools. Education is that whole system of human training within and without the schoolhouse walls, which molds and develops children. Once again, Portia took the liberty of changing it a little bit. W.E. Du Bois said this, and the quote ended in develops men. I took that out and put develops children, because I believe this, and in my conversation with the leaders, this is a message that we want you, researchers and other stakeholders that help create these measures, to know. If we believe this, and the data has shown us for years that other factors beyond the walls of education and care systems have a powerful impact on families and children's learning and development. Now, if we believe this, then we're rethinking our system. Then here are some recommendations that program leaders are challenging us to think about as we consider the possibility of rethinking measurement in early childhood. Next slide, please. Okay, we're rethinking now. Here's some guidelines for us to embrace. The first thing we got to do, well, maybe it's not the first thing. These are not in order, but they're important. They're the key takeaways. We need to shift from a deficit-based measurement system to an asset-based system. We need a system that is holistic and comprehensive. We need a system that considers all the factors that support children's learning and development. We know that a multitude of factors impact children's learning, and we cannot have or continue to have isolated measurements just talking about one thing without broadening the framework first to an asset-based focus, as well as broadening it to consider what we already know are additional factors that impacts children's learning, growth, and development. Now, this last one, the leaders and I agree, because I've been also a Head Start program director. Measurement should not be used as a high-stakes single measure of program success. Your program is successful based on this one measure, or it's not. And that's what we mean about having an asset-based measurement system. We need, as we work together, to have more clarity about what can realistically be measured. Practitioners struggle with measurement when it's used in a high-stakes manner that decides my program is successful, my program has failed, because there's a much more complexity of things that's happening within a program. And I'm just going to use this one example. I'm not singling out Head Start because they made some changes, but the class became the single measure that would trigger a recompetition when the class was never created to be the measure of success of a program, but it was used in that way, and it caused program leaders to struggle a bit with that measurement. So one of the tasks of us today is to help bring clarity about what measures can realistically measure what. Okay, let's move on to the next slide, please. We're still rethinking measurement. We need a measurement framework built upon relationship-based approach. In other words, education, teaching, and learning is a complex relationship process. And that process cannot be oversimplified. And the truth of the matter, hang in there with me, is that children develop in an environment of relationships. Early childhood practitioners are engaged in developing relationships with children that promote children's optimal development and learning. It's a relationship. And every measurement should encourage and empower teachers and other adult helpers involved in children's lives. It should lift them up, encourage and empower them to be the best practitioner they can be in the context of this learning relationship with a child. The other thing that we need to think about is that we need more collaboration tools between researchers and practitioners about integration of data. We got a lot. The good news is we're measuring, we got a lot of data. But we got data from multiple sources. We got the teacher's perspective. We got the measurement results. We got the parents' knowledge. We got all of this. And sometimes program practitioners have a struggle to integrate and connect the measurement data with the other knowledge and observations they have, as well as with the parents' knowledge and observations about their child. Many times it's difficult to come up with an integrated, coherent plan for children, especially if there are conflicting measurement data points and perspectives. So we need to collaborate more around that so we can come together with one comprehensive, coherent plan that all of the stakeholders, including staff, parents, measurement scientists, can agree upon. Okay, so next slide, please. The next part of this rethinking measurement has to do with building and embedding a framework of racial equity and social justice and economic justice into our framework, or into the foundation of what we're creating together. We need more culturally and logistically responsive measurements. We need researchers that represent and kind of look like the population that's being studied. We need the system to include those who are most impacted by the measurement we're creating. And it means sustain family and community involvement in the decision-making, and power must be shared. We don't bring them in and say, thank you very much, see you later. We want them in this new rethinking of measurement. They're going to be at the table and we're going to collaborate together. Teams conducting research should have representatives on that research team that have experienced the lived experience of the population that's been studied. There is value to populations' lived experience, and we have to include that in the framework. And it is a necessity that we have researchers on the research team that can also give insight into the lived experience of the population that's being studied. Okay, let's move on to the next slide. I'm ending this section, Rethinking Measurements, with two mantras for us to take with us. No more research without me. So that means not about me without me at the table, whoever the population is, and that we are in this new rethinking, shifting from doing to doing with. So let's keep that as I close this section of our rethinking measurement. Now I'm going to get into the next slide, please. This other thing that I want to leave with. I'm going to be closing soon. This is functional versus standardized measures. Now, I toyed with this because the leaders' conversation that I had, we used the word formative, but I tweaked it again because I want you to see the definition that's behind this. What the leaders are saying, this representative sample across the country of leaders is saying, we need more functional assessment measures to be used in real time in everyday settings. And we need to train teachers together to use those functional assessments to improve the learning process. So what am I talking about, this functional assessment? Here's a definition that I'd like to share with you and for you to think with me about. Next slide, please. A functional assessment is a continuous collaborative process, accent on collaborative process, that combines observing, asking meaningful questions, listening to family stories, and analyzing individual child skills and behaviors within naturally occurring everyday routines. That's what the teachers want. They want to know how this relates to the everyday routine when I have these children in my classroom. The everyday routines and activities across multiple situations and settings. Let's think about that for a moment. This is really what we as program practitioners and leaders would like you to consider. And this is a collaborative process that values all the stakeholders' input about a child's learning and development. Okay, let's move on. Finally, I want to leave you with this messages. I am going to do an impassionate plea for family engagement measures. We need them. We're not capturing in most of our early childhood programs. I know some of you are, but we're not really capturing what is happening with family engagement in our programs and how does that relate to and connect to and support what's happening in the classroom. So what we need here is a fundamental mindset shift from family engagement as an add-on in an early childhood program to a fundamental, essential component of early childhood practice. That's what we need. And we need more study of teaching practices. I mean, we've already got more study of teaching practice. We need to continue that. I'm not saying we should stop. But right now we have more study on the teaching practices side than we've had on the family engagement side. We need to study the family engagement side. We need to identify effective family engagement practices and measure their impact. Please, I'm pleading with you. We need help with that. Okay, so let's go to the next slide. So, as I close today, I want to say to you that well, let me see if I can summarize this quickly for you. I believe in the conversations that I have had with this sample of program leaders across the country, that taking this approach will allow us to develop more impactful interventions, because our measures will have and take into account all the critical factors that we know have a dramatic impact on children's development, health, and educational outcomes. Make sense? Incorporating these ideas as we rethink measurement in the early childhood system would be, in my humble opinion, the most disruptive innovation that the field can do right now. If we in the field hope for different results, then we must do something radically different than what we've been doing in the last 50 years. Wait for it now, while at the same time preserving and building on the progress and successes that have brought us this far. Think about that. We must work together, researchers, practitioners, policymakers, funders, families, and communities, to develop a radically different way of doing business. I want to leave you with that thought. I want to thank the program leaders that shared their thoughts, next slide, with me. And thanks again to the University of Oregon, Theo Fisher, Tyson Barker, for inviting me to share this program perspective with you today.
Thank you, Portia. We truly appreciate your words and wisdom, and everything that the insight that you're providing us, and how we can rethink measurement within these systems of accountability and practice and improvement and impact. And such a nice way to end the presentation, with an optimistic tone of where we are and where we're going. So thank you so much. I truly appreciate you willing to speak for today. So
you're welcome.
We're going to move on to take a short little break. We have about 5 minutes. As just a quick reminder, please see a link to our event survey in the chat session, and follow us on our various media platforms such as Twitter. And we will be back in about 5 minutes, starting back up at 10:55 Pacific, 1:55 Eastern. Thank you again, Portia. All right, everyone, welcome back. We're going to move into our panel discussion today, which is titled Perspectives on Measurement in Early Childhood. I will be introducing our moderator for the panel, Dr. Joan Lombardi, and then Joan will be introducing the panelists as they speak. So briefly, Joan, the moderator of our panel, is the Director of Early Opportunities, a strategic advisement service focused on the development of young children, families, and communities. In addition, she is Senior Scholar at the Center for Child and Human Development at Georgetown University. Joan previously served as Deputy Assistant Secretary for Early Childhood during the Obama administration, and over almost 50 years now, Joan has made significant contributions in the areas of child and family policy, and as an innovative leader, national advisor, international advisor as well for organizations and foundations. On a personal note, Joan is one of the most dedicated and hardworking people I know in the early childhood field. Her days span starting so she can get on calls in Europe and Africa early in the morning, all the way into the evenings on the West Coast. So I truly appreciate, Joan, you moderating the panel for today, and I'll turn it over to you.
Well, thank you so much, Tyson. I must say the days have been long, but lately they seem to be very exciting. And I want to thank you, first of all, Tyson and Phil. What you're about to launch here is so important for the field. And there's been so much misinformation that I think all of us that are listening can't thank you enough. And if some of you are just joining us, if you didn't hear the first portion where Portia Kennel spoke, I really urge you to listen. Portia, thank you for those words of wisdom. I could tell in the chat that people were responding so enthusiastically. You gave us so much food for thought on a topic that has seemed to dominate both programs and policies. And I was struck listening to you with how positive on one hand the field is about research. They've really come a long way in having a more accepting orientation to a set of situations where they haven't been asked and they have been undervalued in bringing their perspective to the discussion. So you really underscored how important it is that we move to a new way of thinking, an asset-based system, taking it out of the gotcha mentality and really moving towards a more formative assessment. I'm going to introduce our panel. This initiative is going to help us sort out the information that we need on the appropriate use of assessment. And we have a lot to sort out. The difference between developmental assessment used in a pediatric office and formative assessment in a preschool classroom, and how these efforts work together. Moreover, there's a new set of measures emerging that are important to tracking our progress at the community level, at the population level, that I think may help us address some of the issues that Portia outlined. But we have a lot to do. Measurement is not the goal. Measurement is a tool towards our goal, and we have to keep reminding us of that. So we have a terrific panel of four, and let me introduce all four of them and then ask each of them to reflect on their own experiences and what they heard in Portia's remarks. We're going to first hear from Dr. Ioma Aruka, who's a research professor at the Department of Public Policy and a fellow at the FPG Child Development Institute at the University of North Carolina, Chapel Hill. After her 3-year plus experience as a Chief Research and Innovation Officer and the Director of the Center for Early Education Research and Evaluation at the High Scope Foundation. Ioma, the state of North Carolina is lucky that you just moved down there, back there, and we really are all grateful for the work that you're doing around an array of issues, especially equity, across the country. We're then going to hear from Stephanie DeAnda, who's an assistant professor in communication disorders and sciences at the University of Oregon. Dr. DeAnda is a licensed speech and language pathologist, and has published scientific articles focused on single and dual language learning infants and toddlers in Mexico, the US, and Canada. And Stephanie, we are so grateful that you're raising the issues of dual language learning, which is an issue that should be on the minds of every program director in the country. We'll also hear from Jason Gordney. He's currently serves as the interim chief executive officer at Amara, a nonprofit organization serving children and families experiencing child welfare and adoption in the Puget Sound region. He has more than 20 years of experience in child welfare and early childhood programs with a strong focus on supporting families impacted by poverty, systemic bias, and trauma. And Jason, we are just so grateful that you're bringing together child welfare and early childhood, who are natural allies on the same side. And then, of course, finally, we'll hear from Dr. Phil Fisher, and I'm so honored to be on the panel with him. Phil and I've got to know each other in my role as the chair of his National Advisory for the RAPID study. He's the director, as you know, of the University of Oregon Center for Translational Neuroscience, and his research and his reach are just enormous. So thanks, Phil, for coming back to be on the panel. Let me turn it to Yoma, to Dr. Ruka, for your initial thoughts, and I know you have a limited time, so we're just thrilled that you could be with us today. Yoma?
Thank you, Joan. Can you hear me? So good to be here. When Joan sort of moderates, you just do what she says. So I'm very pleased to be here and with Stephanie, Jason, and Phil. And so I just look forward to our continued conversation. So I would say that as somebody who really thinks about issues of equity, racial equity specifically, for young children and families, and sort of both at the program level and systems level, I take away a couple of things from Portia. And I want to sort of, as she was talking, the one thing that came to my head was Chimamanda Adichie's TED talk, right? That says the risk of a single story. And I feel like that was kind of some of the themes that I sort of just heard, is that measurement is so important, and being able to identify measures, being able to identify measures that really help to tell the full story of programs, of children, of families, of systems are really critically important. That we just can't take sort of one slice, one measure, say, this is who you are. This is literally, you are all but this one score on the class, and this is good or bad who you are. And so the danger really of a single story is something that I think really resonated with me. And I would say, as somebody who studies really, families, and thinking particularly from the racial equity lens, that certain groups of families are often positioned as less than, not doing enough, children aren't ready, so early child has to come and save the day. So this single story about families, and that we need to do more to really make sure we have measures and tools that really tell the full story. Like, what does it mean, such as somebody like me, a mother of 2 children in the early childhood world, in the midst of COVID and in the midst of racial, injustice and awareness? Like, what is that? What is the story being told? And what are the measures and the tools that programs and schools can use to make sure that somebody like me or the people are being supported in the best way possible? And then the third thing I feel like I really took away, and I think very much in line with what I think through, is sort of this idea of asset-based framing, right? Like, of course, we want to talk about the needs that families, children, programs have, but it's always easy to talk about the needs and never what are the assets that exist. And so I think, Portia really, I think, brought that forward as we think about, tools and how to continue to do continuous quality improvement, that we think about the assets that many people, programs have, and that by ignoring all the things that are possible and focusing on all the things that are not there, we again tell a single story about your program is bad, your family is bad, and this child is stupid. Like, that is not what we want to position. And so being able to have a way to and that's why I think I really love sort of the PRISM sort of approach that Phil, Tyson, and team took, is really to examine measurement in a way, tools at least, in a way that captures the nuances and the different stories that we're trying to tell, and that the tools are being used in different ways. And how can we at least capture the strengths of tools and be able to balance it in a meaningful way? So I took so much out of Portia's, I think, keynote, and I hope that others did as well.
Yoma, before you have to move on, I'm just wondering if you could tell us a little bit about, what's the advice you give to programs when they're looking to measure their impact? I mean, you spent your life on this. You know, what have you learned about, the do's and don'ts of this? Because so many people are struggling with this.
Thank you. And I'm with you for like 25 minutes, so don't throw me out yet. Um, I would say that, so to me, some of the don'ts is literally like, don't tell a single story one tool. I think it's trying to, I think that's key number one. So take that, don't tell, the risk of a single story. And the second one is actually bringing, I would argue, is actually bringing the end user. Right. So I feel like both being at, UNC and also then being at high school, which is really known for the para-preschool study, but really about how do we support the workforce and programs, is that we have to actually bring the end user, like whoever the end user, we have to actually include them, because as researchers, we come from a different lens. We see things a little differently, good or bad. But if we're not actually bringing into sort of the leaning in on the strength of those on the ground and really doing the work, and really probably, no, not probably, definitely know more than most of us researchers in the Eiffel Tower, in the Ivory Tower, then I think we're making mistakes. I think part of it is to actually lean in on those and actually go through this level of co-construction. I think whenever possible, right? Measurement and tool development is not for the faint of heart. It is not easy, no matter what we try to do. But if there's a way to really do more of the co-creation, that at least minimally, at least says, hey, end user, hey, family members, hey, program directors, hey, teachers, let's interpret this information. Let's interpret these indicators. How do you read it? And I think the best tools that we see are those that have at least done some of that level of work that does take time. And, speaking to, maybe Stephanie would talk about this, speaking to those who may speak a different language or even a different dialect of English, because there's a lot of us who speak a different dialect of English, to make sure that even things that we think are simple, right, like simple words, like on the Peabody Picture vocabulary, literally they mean different things in different communities. So being able to actually make sure that we are at least bringing those who are most going to benefit to be part of that process, I think is critically important. And then I would say probably the third thing I would just add to that list is that we have to sort of challenge our notion about what are we measuring, right? Many a times we're measuring family engagement, like to one of Portia's sort of key like calling card is to, do more family engagement. But we have to question, what is family engagement? Who gets to decide what it is? What does it look like, right? And whose standards are we using? So I think with anything about tool development, it's to really interrogate who leads that conversation, who drives the conversation, who drives the development. And from a racial equity lens, we at least know for most of our tools, they were not developed for or by many people of color or those who have linguistic, who are linguistically diverse. So we have to actually in some ways begin to really go back and say, who was developed, who developed this, under what theory, who was part of it. So I think we just have to do some interrogation, even of our best tools, not to throw the baby out with the bathwater, but we should do some interrogation to just make sure that we have not left certain groups behind, certain cultures behind, certain assets behind, because I think unfortunately we have, because we position many people, at least in early childhood, as needing something, as opposed to bringing something in addition to needing something. So those will be kind of some of my key thoughts.
What words of wisdom? I mean, I think we should have a slogan with this whole initiative that says, we don't tell a single story. It's a great message. And what's great about the audience, we've done a little look at who's listening today, and what's exciting is we've got researchers and practitioners listening together. And I think that's the co-construction that you're after, Yoma. Well, let me turn to Stephanie, and you have so much experience, particularly around these dual language issues. What are your reflections, Stephanie, in your own work and in what you heard this a little while ago from Portia?
Yeah, I prepared a few bullets, and it's funny because many of the things I'm going to just share here in a second of my reflections were 100% things we just heard from both Portia and Yoma. So I'm going to just talk about these a little bit, and you'll see what I mean here. Like you just said, Joan, I'm in the Communication Disorders and Sciences department, so that means that I'm training speech and language pathologists to help diagnose and treat kids that are struggling with speech and language issues. And then as a researcher with that hat on, I work at the Early Dual Language Development Lab, where we're actually trying to develop interventions to serve children from Latinx communities who are learning often languages in place of or in addition to English. And in starting that work, what we came across is that to develop interventions, we had to really start from square one and develop tools to not only identify the children that needed our supports, but also to help track their progress and measure success, as we've been talking about. And so we know that language and communication concerns are the overwhelming reason kids get referred to early special education services. And therefore, we really need good measures that are centered on language and communication. But what we've learned, unfortunately, is that we don't have the appropriate tools for these vulnerable families. Full stop. I mean, in my field of speech and language pathology, we have few available tools for kids that don't speak English or multilingual families. And this is not just unique to Latinx children. Our measures are often centered overwhelmingly on English and English monolinguals also. So not just, a measure that's, a lot of kids are learning English in this country, but many of them are learning them in multilingual contexts, and that actually presents a whole other learning environment. And so for even as Ioma just talked about moments ago, even kids learning English, we aren't doing a good job of describing the dialectical variability. We've underserved historically as speech language pathologists, kids learning African American English. In fact, we've used terminology that pathologizes a totally typical dialect used in the United States. So in the absence of these measures, we're often left making the same mistakes as Portia was talking about some moments ago, that we were using tools intended often for English speakers or for white children, and then examining and using them with more diverse families for whom these measures were never created for, and they're frankly inappropriate. And to Portia's point, what happens is then we use these inappropriate tools, and then we end up looking at these children as a deficit because we're using constructs that are actually relevant in their context. So my hope is that the Impact Repository tool is doing a couple things for us. I think it's got a lot of excellent potential, but there's two things that I want to highlight. One, I'm hoping that this tool helps us think critically and carefully about the ways in which we measure what success means in linguistically and culturally diverse children. So it's pushing us to think in a multidimensional way, critically about all the different things that a particular tool can bring. And I think others have mentioned that point as well. And two, just the simple act of bringing together and having a repository of several measures helps us see where these gaps are, right? Because we can actually kind of put these together and go in and say, hey, I don't have a measure for this. So I'm also hoping that just from a really practical perspective, it really clarifies where these gaps are, and that pushes us to create measures, as Portia said, that are not just for these children, but are created with these families as well, so that we're not just going into these communities and creating them and deciding what success means for them. And I'll end with this final thing. Portia also mentioned the importance of having diverse perspectives at the table. So not just the families, but us as researchers. And so I'll share a little bit because it might not be a surprise to all of you that my overwhelming focus on the Latinx and dual language learning community is because that's who I am. I'm a Latina, my first language was Spanish, and so these issues are personal to me. So I'll just share a little anecdote and then I can turn it over to you. But as a child of Mexican immigrants, when I started school, I only spoke Spanish, no English at all. I was only hearing Spanish at home. So it was only until I really started school that I was exposed a lot to English. And at that time, as I was growing up in California, bilingual education was supported. So I was going back through some years ago through papers my mother had saved, and from that time, and I actually found assessments that were actually in both Spanish and English. And I learned to read in Spanish first, well before I learned to read in English. And so I think back, since then, they actually, if I would have been born a few years later, California would not have had bilingual education anymore. There was a period of time where that wasn't the case, and there was English only instruction. So I think about those children during that time, and many others for whom this is still true. Would my Spanish have been measured, and would it have been seen as a strength to be leveraged? Would it have been measured at all? And I don't know the answer to that, right? But what I do know is that I feel hopeful by having these conversations that we're centering the voices of children who are growing up, learning more than one language beyond just English, like many in my Latinx community, because I really believe that these measures, hopefully in the future, will reflect every part of who we are.
Well, Stephanie, you have such a hopeful message. And I, as someone who grew up also with immigrant parent, during an era where the goal was to learn English only, and losing your home language, I can tell you we need a much more hopeful message. And I want to come back to you later about your comment about what success means and how we marry together the measure with our goal, because sometimes there's a mismatch and that's the problem. But before I come back to you, let's hear from Jason. You have so much experience, particularly with the child welfare system, and which, unfortunately has had sometimes not the most positive use of measurement and assessment that leads to important impacts on children. So Jason, take it away.
Thanks, Joan. And I just want to quickly say, I am on Zoom calls all day long, all week long, and it's not until it's like my time to present on this webinar that my Wi-Fi just decided to drop about 5 minutes ago. So I am back on. If it drops again, I promise I'll be back. I'll just switch over to my cell phone. So if those are just the kinds of.
We're with you, Jason. We've all gone.
Yeah, perfect timing. So anyway, thank you very much. Good morning, good afternoon, everyone. It's really an honor to be here with the other speakers and other panelists today, and my wheels are really spinning and listening to other folks' perspectives and comments. So I'm going to give a kind of a high-level summary of just some issues that I've noted in my experience related to evaluation, working with really a variety of early childhood and infant mental health programs over a number of years. Earlier in my career, I was in child welfare. I sort of took a 12-year break or so and went into early childhood programming in a big way. And I've recently come back to child welfare. So I'm going to focus really on my early childhood experience. So when I entered the field of early childhood programming, it was really in the context of evidence-based programs. So those are programs that were funded through primarily through public dollars at sort of all levels. So federal, state, county, city, sometimes through private foundations. And in these programs, evaluation was generally driven by funders and by program developers. So I just want to underline what Portia said earlier, that that measures did not include participation. Selection of measures did not include participation from families and communities. And I just couldn't agree more that they should have been, and they should now be at the table and should continue to be at the table in determining what's important to evaluate and how to evaluate that in these programs. So having said that, when I came into the field, evaluation was really focused on kind of three things. One was fidelity of implementation. One was outputs, and the other was outcomes. So fidelity meaning, are we implementing in the way that the program was designed to operate? Are we sort of following the recipe that was prescribed, in other words? Outputs meaning, how many kids and families were recruited, how many completed the program, how many home visits were provided, those kinds of things. Outcomes were either measured by evaluation tools that were sort of built into the program models by the developers and were sort of unique and proprietary to those programs. There was sometimes flexibility to choose evaluation tools to measure things like child development, for example. But so there's not a lot of flexibility when I came in around what tools to use. So I'd like to just mention a couple of consequences of that approach to evaluation. One of those is it was really difficult to sort of compare the relative effectiveness of different programs. So I was at an organization that offered like 3 different home visiting models, and we weren't using the same evaluation tools across programs. And most of those programs had very similar eligibility requirements, and it was really hard to know like how to direct families to which program, because we were using sort of different measurement tools. They were sort of aimed at different things, and we just didn't have ways to kind of to have data help guide us around who was most likely to get benefits from which of those models. So I would say more broadly, it also sort of set up, I guess, an unintended incentive structure for organizations like mine that could be problematic. You know, organizations were really incentivized to provide services, you know, to the number of participants that they were sort of being funded to serve, and then to, you know, kind of show that they were getting the outcomes that they were supposed to get, right? So if you're implementing an evidence-based program, you should get the results because it works, right? So, you know, if they don't work, then you know, you must be doing something wrong. And I think others have sort of called attention to that tension already. One of the things that I noticed was that sometimes the evidence-based models may have been developed and tested in one cultural context, and now they were being applied in a completely different cultural context with, you know, really different uptake and enthusiasm from sort of different communities, depending on how relevant, you know, those services those programs were to those communities. Sometimes that could be positive, you know, some communities really responded, sometimes it was negative, they just didn't find it relevant. I think the models that had the flexibility to adapt to the local context and were delivered by community members tended to be the most popular and sort of have the kind of best outputs and outcomes. So, you know, I think unfortunately another unintended consequence of evaluation can be, it can create incentives for organizations that are funded to provide these models to recruit those who are going to be most likely to succeed. Maybe not those most in need of support at times. I think another really important point about those programs, you know, in my experience was that we didn't really have a lot of clarity and precision around sort of what the mechanisms of change were. So there was an expectation to implement the program to fidelity, and then the assumption was that it would work, but we weren't necessarily measuring how the program activities were leading to change in most cases, and I think that limited our ability to learn and improve. Okay, so I want to just kind of shift a little bit to something that I was very influenced by and I've seen be very influential in the field, and that is sort of when awareness began to grow about the body of research that the Center on the Developing Child was promoting. I think we began to realize that we weren't actually measuring a lot of sort of what were the key ingredients that were most likely to be leading to positive changes. So those sort of three principles that the Center on the Developing Child has been promoting around reducing sources of stress on families, promoting responsive relationships between adults and children and adults in children's lives, and strengthening core skills in kids and adults who care for them. We sort of looked at our programs and realized, well, we're doing a lot of those things, or we think we're doing a lot of those things, but we aren't actually measuring and tracking progress on most of those things. And I will just call special attention to the stress of racism and experienced racism for the families we were serving. We certainly weren't paying enough attention to the impact of that. And that's something we need to get better at. So another part of my work was not just implementing these evidence-based programs, but I really had the opportunity to be involved with the Frontiers of Innovation initiative in partnership with the Center on the Developing Child in the state of Washington, going back to 2011. And really the goal of that initiative was to take these kind of principles that research had shown, you know, were the things that supported healthy child development, and look for ways that we might sort of modify or add components to existing programs to make them sort of more impactful and more effective. So we ended up partnering with just a number of researchers from around the country to test out some new approaches that were grounded in that research in our existing evidence-based programs. And you know, in working with researchers and developing evaluation plans for some of the pilot testing that we did around that, I think we learned some important lessons about real world evaluation. I just wanted to share a few of those. One of those, and people have already brought it up today, so I won't spend a lot of time on it, is that linguistic and cultural relevance is just critical. You know, we were serving just an incredibly diverse array of families here in the Puget Sound region, from all different backgrounds, folks who had immigrated from many different places. And it was really challenging to find evaluation tools that were appropriate for those communities. Another important lesson was learning to, you know, measure really what's important at, you know, a particular stage of testing something out, testing a new innovation out. I think in the beginning, there was a tendency to kind of follow a typical research approach, which would be measure lots and lots of things at the beginning, do the new service or the new approach, and then measure all those things at the end. And I think what we actually did was end up not necessarily measuring the effectiveness or sort of the acceptability and feasibility of some of those new strategies. We ended up measuring sort of the acceptability and feasibility of those new strategies, plus like a 2-hour measurement battery at the beginning and a 2-hour measurement battery at the end. And what we found was a lot of folks just didn't want to do that. They didn't find it relevant. It was a hassle. And so we didn't end up learning as much as we could have had we really simplified and shortened those evaluation tools and really involved the community in selecting what those were and making sure that they felt relevant and people understood sort of why we were measuring what we were measuring. Okay, so I think I want to just summarize a little bit, and then we can go back to the panel. So, you know, I think my key points here are, again, to just affirm what's already been said, that families and communities should be involved in measurement selection and should be at the table sharing power in how those measurements are used. I think we would benefit from more common metrics across different program models so that we could begin to learn which of those is more effective for whom and in which contexts. I think working toward greater precision and clarity in the ways you know, in which we believe programs are effective. So really focusing on those active ingredients and then finding ways to measure those active ingredients within programs. So not just measuring outputs and outcomes, but how do we actually get to those outcomes? How are we really paying attention to those key ingredients? And then let's look for ways to continue to improve services. You know, evidence-based programs are a great start, and let's not be satisfied there. Let's continue to push the field forward and take a really smart approach to learning and evaluation. So I'm going to stop there. I had an opportunity to sort of test drive a version of the EC Prism platform this summer, and I got really excited about it. I'm glad that it's going to be available for use soon and that it'll continue to be developed. I think it's going to be a really helpful tool in addressing at least some of the issues that I've called attention to. So thank you.
Thank you so much, Jason. Before I turn it over to Phil, I just have to reflect on a few things that you said. First of all, thank you for reinforcing the implementation issues that we really need to learn more about. It's those key ingredients to these programs that we need to understand more. And secondly, that, you know, I think we've been moving over the last few years from black box evaluation to formative assessments that are more ongoing and are tools to improvement rather than this, you know, gotcha mentality. And finally, I think we need a lot more discussion about what are we doing in programs to alleviate stress on families rather than putting more stress on families, which I think sometimes we do. And so much of what you said, we could spend another hour talking about, but let me turn to Phil, who's, I know, been sitting there and kind of thinking about what does all this mean? And I think both of us have had a very emotional reaction to the amazing comments. Phil.
Yes, indeed, Joan. And first of all, let me thank you for moderating this session. As always, your words of wisdom are really important guides for the field in how to think about these crucial issues. And also let me thank my fellow panelists and of course, Portia and Brenda, who's going to follow for, I know what will be also amazing words of wisdom. I'll keep my remarks brief, but I really just want to reinforce the points that have already been made, which is I think the intentions behind the efforts to embrace evidence as a way to promote well-being in families by selecting programs that have potential to be impactful historically was a well-intentioned effort. And at the same time, like so many of the other issues that are really ingrained in the fabric of our field, I think they bring with them issues that need to be addressed and have needed to be addressed for a very long time, that have everything to do with equity and disparities and the way in which we haven't really acknowledged these, not just societally, but then more specifically within our field. And I think these comments are really shining a light on all of how that has evolved. I think it's not necessary to tear down what we have come to see as the gold standards of evidence. There will always be a place for randomized trials to evaluate program impacts. There are clear reasons why those kinds of approaches are seen as the most scientifically rigorous. And at the same time, by singly embracing those in the kind of high stakes gotcha kinds of approaches that have been described, we essentially have disenfranchised a vast portion of the early childhood field in being able to participate and own the question of what program impacts mean. And I think by doing so, we've really just limited the extent to which community-based programs, novel programs can really flourish. I think we've kind of tied the hands of policymakers who feel like they have to avoid the risks of innovation and can only implement programs that come with the stamp of evidence. And I just think what the future, in the immediate future, holds for us is a need, and this is hopefully part of that larger effort, to redefine what we mean by evidence and what we mean by evaluation. Evaluation should be about tools for learning and for constantly driving forward to be able to support the well-being of families, to be able to have programs reach more people more effectively, and to promote optimal outcomes, and not simply be, a ticket to funding, whether it's philanthropic funding or public funding. And that doesn't mean that evidence is irrelevant. It just means that evidence needs to be democratized. The tools for obtaining it need to be democratized. How we define it need to be democratized. Well, there have been many really rich conversations that I've had. David Willis has been one of the people at the table around this. Even concepts that have been at the center of our field, like attachment, are really typically conceived of from a 1970s white middle class lens. And it's very hard to envision how we can evaluate programs when we're bringing concepts that are that are ingrained in our measures that are very limited in their focus and haven't evolved from the get-go in terms of how we think about these things. So by putting a stake in the ground around, here is a repository of measures in the field, one of the things that we're hoping we'll be able to do is drive people to a place of access where they can decide for themselves from what's available according to the dimensions that Tyson showed when he put up that diamond-shaped model of what's important to them. And that means that if it's important to you that your the measures you're selecting have been validated in the context of the communities in which your program exists, that you can prioritize that when you're looking at the measures. That's incredibly important. But it also means we're not simply saying, here's the whole compendium, your only choices are what's in it, and that's the end of the story. We truly hope that this will empower those who have ideas about what need to be measured to begin to develop those measures and to add those measures to the repository, and that this will be a field building tool so that we can grow measurement from the ground up rather than from the top down in ways that will continue to accelerate the extent to which the perspectives that don't necessarily come directly from academia can be an equal player in the landscape of evaluation. That is really our hope and dream behind this. And so I hope that everybody will see when we get to the launch of the impact repository, that it's simply a starting point. I think too many of these initiatives are like, we're ready, we're here, we've reached the finish line, go, we're good to go. And we see this as just a beginning to the process of how we can essentially make measurement a very different process, redefine what we mean by evidence, and really change how we think about how resources are allocated as a result, to be able to optimally support families in the context of early childhood. We hope this will be a tool that's useful for program developers. We also hope that it's a tool for community organizations. We also hope that it'll be a tool for policymakers and private funders who are trying to help their fundees develop more adequate learnings about what's working for whom and why. And so that's really the goal behind this. And I'm just so personally full of gratitude for everybody who's participated, both as speakers and as attendees to this presentation, because I think it really does represent the groundswell of interest in these kinds of approaches, and hopefully will provide momentum as we continue to move forward on this really important work.
So we still have a little time, so I want to come back to Stephanie. Before I turn to you about your comment about what success means, I do want to pick up on just two things that Phil mentioned. This repository is not like going shopping in a supermarket and you pick up an item. That's not really the image here. This is going to be interactive. So you have to pick something, look at how its key elements, talk to the people that help put this together. This is interactive, and it's also living, so that if you're experiencing something with a measure, that you provide that feedback so that the next generation of people that look at that measure can learn from you. So this is, an interactive experience they're about to launch, and it'll be a journey. So Stephanie, let me go back to you about this mismatch that we often see between what a program is meant to do and the tools they pick to measure that. And what does really success look like, particularly in a multilingual setting?
Yeah. So yeah, regarding the success piece, I think a lot in my world, often success has been pitched to mean English. You have to be an English speaker. You have to use it and know how to read in it and all of that, right? And when I think if we were to have conversations that were broader, that would help us to think about success in different ways, like it did for me. That success can also mean being able to communicate with my family. Success also means in whatever way that works. And frankly, I continue to grow in this area. More recently, I had colleagues reach out who are working with children that are deaf and hard of hearing, and pushed me to think even further about not just the languages kids are hearing, but the fact that they're not just spoken languages that are important as well. So I think about those children too, that what success means for kids who don't have access to spoken language, but visual languages and others. So I think, yeah, what success means has to start with these families themselves, and they have to Portia's point and others, they'll help us define what that is. And we can't decide for them. we have to decide with them at the table.
And you have to be sensitive. You know, I think if you would have asked my parents, they would have said, make sure she learns English.
Mhm.
Yes.
Would have said, and yet, you know, 70 years later, here I am not, you know, having the facility that I'd like in the home language. So, you know, that wasn't successful really. And so bringing people along and not having, not assuming we have the answer, I think is key.
And I think you said something important there too, Joan, about thinking in the future as well. So for a lot of times we come in and we say English is important, and then it might take the place of that home language. But I did need my home language too for lots of social and important reasons. And so I think for us also thinking about what is success now, but what is success in the future? What are you going to need to be successful functionally in the future as well? Yeah.
I want to thank you for that, and thank you for your work. This is an issue that, again, we shouldn't leave the dual language issue to a small group of people on the side. This is a mainstream issue, and it's got to be integrated just the way any other equity issue is integrated into our programming and our measurement. I'm going to ask a kind of odd question of both Phil and Tyson, and that is, there's several terms here. There's the Impact Center, there's the tools, there's EC Prism. Can you help us sort out the language? How do you want us to talk about this project?
Really a great question, Joan.
I asked you this before, but it struck me in the middle of the panel.
Yeah, and it's interesting because there have been a couple of comments posted in the chat about this. I'll say something quickly, but Tyson, I also think people should hear from you. The repository is one piece of a suite of tools that we're developing, and they're very tied to this broader sort of framework, which is the PRISM, the EC PRISM framework. The PRISM framework is specifically designed to provide support and technical assistance around measurement and impact evaluation. And it includes tools that help with the development of a theory of impact, which sometimes is referred to elsewhere as theory of change or conceptual model. It definitely refers to the kind of technical assistance that we provide to help tie the theory of impact to the selection of measures, and then to the kinds of decisions that have to be made around the type of evaluation designs that are reflective of the kind of formative processes that people have been talking about. All of these things go together. And one of the things that we've seen actually with some of the other compendia of measures in the field is that if they're just sort of a gigantic list, it doesn't really help with the progress that needs to be made in the whole question of how you go about selecting measures, using them. What do you do when you get data? How do you construe the evidence that you're accruing, and how do you use it for the subsequent iterations? So very much so, these things are all part of a larger whole. Tyson, what else would you say about this?
Tyson, you're on mute.
Oh, sorry. Yeah, no, I think as Phil was saying, we see this as the tool is a complementary piece of the technical assistance and consulting around measurement and evaluation that we provide. The way we often think of it is the path toward improvement and impact is not necessarily a direct kind of research science to practice approach, but it also includes embedding science-based tools within practice. And that is one of the missing piece what we often see that's lacking is how do we provide tools that simplify decision-making processes. So the tool is based on high scientific evidence on what makes a good measure. And I won't bore anyone with the number of scientific terms like psychometrics that go into the scoring system, but that information is then distilled in a way for those who don't need to know that level of detail, but can know that they're making good decisions on high quality measures that not only are high quality for everyone, but also high quality for various contexts and communities, which is a piece that we've seen that's lacking. The related part as well, usability. So how do we rate measures and kind of quantify just usage of like, can this be done quickly and efficiently? And again, those are all all decisions that have to be made within a program and a practice for practitioners. And we see that kind of as of a tool among that larger framework.
But we should refer to this as EC Prism rather than those individual pieces, right? I'm going to do that. Because I think the
Great.
terminology is going to be important in communicating this. So these are all great points. Katie, I'm going to turn to you to see if you can tell us if there's some questions coming in from the chat.
Absolutely. Thanks, Joan. So the first question that we have here is from Revere Joyce. And I just want to highlight that Portia has added a response in the chat as well. So Portia, if you would like to jump in and add anything further, please feel free. So the question from Revere is, how do you measure family engagement beyond attendance?
Oh, yes, I wrote a long note in the chat box. Hope I didn't insult you, whoever you are out there, by starting with basics. And what I did offer also is to send information, at least about the approach and how to operationalize the approach from an Educare Learning Network perspective. But what I said in the chat is something that seems very simple, but sometimes I find in early childhood we overlook. First of all, we have to, if we want to help parents help their children learn, we have to build a relationship with the parent. And I have found, not everywhere, but I have found sometimes in early childhood, we tend to skip that part and go straight to the teachers, to the children. And the parent is not an intervention for us to get our work done in the classroom. The parent is the context and the powerful influencer of the learning. So what we've got to do, in addition to being our best practitioner self in the classroom, we've got to build an adult relationship with that parent, which means you've got to get to know her wishes and desire for herself as a person and for her child. The parent needs to know that not only do you care about her child, but you care about her or him or whoever they are. And there are things you can do in your approach to build that relationship, because I believe if you build that learning, respectful relationship, then we can talk about what other things that families can do to contribute to their learning, but they're not going to hear that unless you know them. And it won't stick. So it's a long 100-page manual on that. And I'm happy to send it to you. But that's my first thought. And I don't know if that's applicable to what the person who raised the question is about, but I found sometimes in my experience, when I look deeply at what people are saying, it's like, well, parents, how do we make it? They ain't showing up for the activity. Now, do we have a relationship with them?
Maybe that's the evaluation. I think this whole conversation about family assessment and assessing our work with families, not assessing families, we could do a whole webinar on it. And I think we're going to turn to your guidance over the next few years, Portia, to help guide that conversation. Other questions, Katie?
Yes, we do have a few more. So we did receive a question from Sheridan Green. This was directed specifically to EOMA, but I think other folks might have things to share as well. So the question is, EOMA, I very much appreciate the prospect of measuring what children and families are bringing in addition to what they need. This may be deeper than attempts at strengths-based measurement. Do you have any thoughts about what this expansion or change might look like?
And Jason also touched on that, so I don't know if you want to answer that or Stephanie. Strength-based.
So the question, the question was about strength-based measurement and just how we think about that. For me, it starts from square one. Actually, I think Portia and others made this point too, like the power of observation, And sometimes it's as simple as starting there, just observing what the success means for this family or this child, and rather than coming in with some predisposed ideas about that, but actually taking a step back. So that's where it starts for me, taking a step back and then having those conversations with stakeholders, but being really clear that you're like about your limitations, that the tools you're bringing with you, the perspectives you're bringing with you, where do those come from? Thinking critically about those, who created those, and am I bringing those to the table? And if not, why? And so to me, that reiterates some of the points you're making earlier as well, just about the power of observation and thinking about where our current standing is, and it really is about the critical piece. Also starting with yourself. A lot of times I have these conversations with students and training them to go out and do this as speech language pathologists. And often one of the basic activities is just asking yourself, what is your cultural perspective? What influences your lens? Because when we recognize that we come in with predispositions about what we see as a strength or what we see as a fault, if we can understand what that is, then we're better able to mitigate that in the moment. So I think it's multiple things, but those are a couple thoughts that come to mind.
Great. That's great. Katie, I think we have time for one more quick question. Do we?
That sounds great. So we do have one more question that we can ask here. This question is from Akila Nakanti. And so her question is related to the danger of a single story. She says, I found that some advocates worry that highlighting negative experiences within certain groups, e.g. experiences of child abuse in non-white families, may result in those findings being used to pathologize those groups and set advocacy groups back by several steps. So how can we ensure that by highlighting the unique lived experiences of our participants, we do not harm these communities?
And I know Ioma put some response to that in the chat, but I'd open it up for any other final comment.
Well, I'd like to channel what Portia taught me in the last, period of time that we've been working together, which is that what's important is contextualizing the experience.
Yeah.
That simply putting data out there that say, this group looks worse than that group, or there are more challenges being faced by that group than this group, just reinforces all of the preconceived stereotypes that may exist. But when you talk about why, this came up in our rapid survey early on when we had a finding that showed that Black households were using less medical care than other households.
Yes.
And the immediate concern is if we make note of this in our postings and our blog postings, is that just going to reinforce a concept or a thinking that Black households don't care as much about their children? And the clear antidote to that was to describe what Black households and Black people in general have experienced at the hands of the medical system historically, and that there's not a lot of trust there in many communities, and rightly so. And so I think the understanding of it's simply we're just researchers, we're just putting out the information, is really, I think, a morally bankrupt perspective. It's without context, information is meaningless, and with context, you really can fight against some of those things. So Portia, I don't know if I correctly represented the learnings that I've taken away from these conversations, but I'm hoping that I got it somewhat right, and I'd really welcome your additional thoughts.
She's smiling, so I'm going to take that smile as affirmation, because I know we're just about out of time, but I can't think of a better way to end this panel, which has been amazing, and I think we all thank you, panelists, for those remarks, with this conversation about cultural context and how important it is in both programming and measurement. Again, I want to thank you, but I'm going to make one final plea and take the prerogative of the moderator. And that is that, as a public official, I had to implement policies that were developed by policy makers and decision makers that didn't really understand measurement. So I'm urging Phil and Tyson to really bring these messages to the policymakers, so we don't get, you have to use this kind of evidence or you won't get funding, or you have to use this measure, or we'll close you down and get this result. Those days should be over. We should use measurement as a tool for program improvement, community improvement, and I think the Early Childhood PRISM effort will help that. So with that, I'm going to turn it over, I think, back to Katie, because I believe we have a break before we hear, I'm sure, an amazing final presentation by Dr. Brenda Jones-Harden.
Thank you, Joan. I'll kind of close us off. We'll be taking about a 10-minute break and coming back at, let's see, at 12:05 Pacific, 3:05 Eastern. And just want to say thank you so much, Joan, for moderating the panel, and as well as all the panelists and the insights that you've provided. I hope that conversation kind of serves as a starting point for future conversations, and it also serves for our team internally as a way to continue to innovate and think differently as we develop the impact measures tool. So we'll see you all back in 10 minutes. As a reminder, please see the link in our survey, see the link in the chat for the survey, and follow us on social media as well. So see you back in about 10 minutes.
Was the hugger. Tyson must have been the hugger.
Well, we'll go ahead and get back started. And thank you everyone for hanging in there for a long Zoom webinar. I hope it's been helpful to hear the various perspectives from all the speakers. So I'll go ahead and introduce Dr. Brenda Jones-Harden. Dr. Brenda Jones-Harden is the Allison Richmond Professor of Children and Families at the University of Maryland School of Social Work, and she directs the Prevention and Early Adversity Research Laboratory, where she and her research team focus on preventing maltreatments and other forms of trauma. She has conducted numerous evaluations of such programs, including parenting interventions, early education, early care, home visiting, infant mental health. And Dr. Jones-Harden also has consulted with and provide training to numerous organizations regarding effective programs such as home visiting, infant mental health. She's a scientist practitioner who uses her research to improve the quality of effectiveness in child and family services and to inform child and family policy. I'm very lucky to have got to know Brenda from my graduate training at University of Maryland when she was there as a professor. And one thing I've always noted is Brenda is able to is highly respected in academic circles and is able to talk with such clarity in terms of with other those in research and evaluation, but also really understands and based on her experiences as a practitioner, how evaluation and measurement affects communities, affects practitioners, particularly those families of color and those who face adversity. So I'm very pleased to introduce Brenda. I think she brings an amazing perspective to close out our webinar today. Her title of her presentation is Equitable, Ethical, and Effective Use of Measurement in Early Childhood Research. Thank you, Brenda. I'll let you take it away from here.
Thanks, Tyson. And actually, I was going to say how proud I am of Tyson. You know, I'm getting long in the teeth, as they say. So it is so nice to see the people that I've known in their graduate training grow up and do bigger and better things. So it is just so much fun for me to see Tyson doing this. But the other thing I want to say, I'm really happy to be on this important panel, and so many of my friends and colleagues like Joan, Portia, and Neoma, all of whom I've worked with for a very long time, are on this panel. And because we think alike and we walk in the same circles, you're going to hear a lot of overlap actually between what I say and what they've said today, because we all learn from each other. So I'm so glad to be a part of this. So go ahead to the next slide. So I wanted to start with sort of thinking about the why early childhood measurement is so important. And as Tyson said, I'm coming to you as a person who lives in the research world now, but really views research as important for practice and policy. So for me, if it doesn't inform practice and policy, it isn't really important. So obviously, one of the first things I want to say to the practitioners here is, you know, different from when I first started, now you have to have some kind of measurement of your work to prove that it is effective. I mean, this was not happening when I first started my career, and even the funders are now on the effectiveness bandwagon and want to think about evidence-based practice and things like that. So it's great what Phil and his colleagues are doing out in Oregon, because this is critical for any kind of good policy and practice work. But the other thing that I think is really important, and again, this is different from when I first started as a practitioner, we use data in a different way. And it helps us not only to understand whether our programs are effective, but also how we can make the changes midstream. So what we can do about continuous improvement. And one of my favorite projects is one in which we only collect data that's used for continuous improvement of programs. So I think that's critical. So you're thinking about it not just at the end, but sort of in a formative evaluation way, where you're thinking about how can we tweak programs, how can we change our strategies as we learn whether or not they're being effective in the short term. The other thing clearly is that we want to think as hard as we can about the outcomes of the little kids whom we're working with. And, you know, I want to move us beyond just thinking about their learning and their academic outcomes, to think about, I'm going to channel my advisor, Ed Ziegler, who was one of the architects of Head Start, who always said you have to think about the whole child. You have to think about the child's health. You have to think about the child's mental health. And certainly for young children, we know how integrated those developmental domains are. So we have to really make sure that we're doing this. And we have to think about it, as many of the panelists have said earlier, not just sort of what happens with children in general, sort of using the basic kind of developmental knowledge we have about middle-class children, but we have to think about what it means for specific target groups and even within your program. So instead of comparing children to a national norm, for example, to see whether your program is effective, comparing children to the children within your community, comparing children who are within certain classrooms to see if they're doing better than other children in classrooms. It tells you a lot about children's experience and that bidirectionality of what they're getting in the context of a classroom and what they bring to their own development. So really not just looking at, okay, 100 is a mean score on a child development measure, and if children don't reach 100, they're not growing. Really thinking about what happens over time with these kids, but also how they look compared to other children in their community. And clearly we want to examine things through an equity lens. And I have to say, you know, in research, they teach us to control for race and to control for income, but probably the better strategy is for us to disaggregate the data to see whether there's a difference for children in terms of their outcomes of particular interventions. And one of the ones I like to always bring up is the early Head Start data that suggested it really looked like it had a huge impact on Black children. Certainly we can't say that it's better for Black children than it is for other children. But what was interesting was when the group disaggregated the data and looked at white children versus Latino children versus African-American children, you saw some very different impacts. So certainly disaggregating the data to be able to ask those kinds of questions. Okay, next slide. The other thing that I wanted to talk about in terms of the importance of EC measurement is really thinking about the contextual factors. And I know Portia talked to you all a lot about this, particularly in terms of parents and family, but I want to argue that we want to even stretch it a little farther and think about what the impact of neighborhood and community are. One of the former panelists was talking a little bit about child welfare and home visiting. And one of the things that we're discovering about poverty, for example, and about child welfare is that impacts for children really do vary by community in terms of things like what the concentration of poverty is, what's the concentration of a particular cultural group, what are the sort of supports and services in a community and how those impact kid and family outcomes. So really trying to think in terms of larger context as well. Also things like structural racism, income and race ethnic inequities are certainly important to think about in terms of this. And if I could say a word about income, we always measure income in all of our studies, but I'll tell you the truth, it gives us very little. What we find, one thing is that families don't even know really how much income they make. And oftentimes, you know, they might be a poor family living in a multi-generational household where when they combine all of their income, they're in a very different place. So we argue for looking more at parents' perception, like food insecurity and nowadays utility insecurity and all those kinds of things as a way to help us understand these inequities and not just sort of leaning on the same data that we have for a long time in this field. But the other thing in terms of racism, and I'll talk about this a little later, is to think about perceptions of families in terms of experiences of discrimination. And we have started adding the everyday discrimination scale. It's not my scale, I'm not advertising it necessarily, but we've started adding it to all of our studies. And amazingly, we're finding, I mean, it's not amazingly, of course we'd expect it, but we haven't been including it until the last few years, that it predicts a lot. It predicts a lot in terms of parent functioning, but also in terms of parents' capacity to care for their children. And then obviously for us in the early childhood community, this kind of measurement gives us a standard for examining quality in early childhood programs. And I'm going to talk about that a little more, but I will just say here that, again, thinking about this from the lens of social justice is something that's really important, and things that we haven't really paid as much attention to. For example, the inequities among staff. We know that a lot of the caregivers in early childhood programs are women of color. We know that they experience a lot of trauma. We know that they don't have a lot of wealth. We know that nowadays we see high rates of depression in them. We're starting to ask these kind of well-being questions that certainly have impact on the practices that they engage in. So really thinking about their functioning and how the inequities in society, which allow for people who are working in these programs not to have the kind of supports from the society at large and from their programs, how this does impact on practice. Okay, next slide. So I wanted to think a little bit, this is where I'm getting a little on the research side, and I heard Tyson say something about we don't want to talk about psychometrics, but I'm going to talk about psychometrics just a little. But I wanted to think about types of measurement a little bit as we think about working with community-based programs in early childhood. I mean, I am a fan of observational measures. Obviously, I was trained as a developmentalist. This is the approach that we often have in this field, but I will say that we have a long way to go. And I heard somebody mention something about attachment measures before, and certainly one of the criticisms of the attachment observational world is that we kind of think about attachment to one person instead of multiple caregivers that children in minority groups might be experiencing. So to some extent, we're not really learning what we could be learning about things like those core developmental processes like attachment. But I am a person who advocates for these kind of observational measures. I want to push us, though, more toward looking at naturalistic kinds of ethnographic observations instead of limiting ourselves to the structured and semi-structured ones that we do, because they do have limitations for our understanding of what happens in certain groups. If you think about it, the structured and semi-structured observational assessments grew out of somebody spending hours and hours doing that kind of naturalistic observation within certain communities. And I certainly think, we have a long way to go to sort of think about what might be more appropriate for certain target groups. So we might need to do that naturalistic work more. And I have to say a word about our coding approaches. I am a person who started graduate school coding parent-child interactions. I remember being in New Haven, and there was an unusual tornado in New Haven when I was there, and I had been sitting in a dark room coding parent-child interactions for 12 hours and went outside and saw trees on the ground and said, what happened? So I believe in coding. I was trained as a coder. Again, I will say that there are many times when I look at coding schemes and say, this does not really seem appropriate for certain groups. And I'll mention one thing, the intrusiveness. Any of you who've done parent-child interaction will remember that intrusiveness variable. I had an experience one time where I had 2 postdocs doing coding on parent-child interaction. And one of the things we look for is, reliability between the 2 coders, making sure they're, in the same vein on all the variables. And they were like within a point of each other. I mean, just so close in terms of how they view all the interactions between the parents, with the exception of intrusiveness. They were so far apart on intrusiveness. And the truth is, one was a Black woman, and she tended to not see intrusiveness as often as my white postdoc. They both were really smart, very competent women, but had a very different perspective on intrusiveness. So this is the kind of thing, to me, that suggests that we need to look a little more carefully at our coding approaches. Obviously, I'm a person who's going to suggest that we need to use multimodal methods, multi-methods when we do these kinds of things. A lot of times we'll learn from qualitative work what we didn't get from quantitative because the parents just hurrying through, trying to fill out the form, etc. And certainly I want to argue for using qualitative methods as a way to inform what we do on the quantitative side. So using focus groups for feasibility, one, what makes sense in terms of quantitative measurement, but also the process itself. Like in focus groups, you can learn whether parents are going to be willing to do a 30, 60, 90-minute phone call in this virtual world, etc. So I'm just arguing for taking some planning time in the beginning, doing some qualitative work, trying to figure out what makes sense for your real evaluation or real study. Now, again, I'm a developmentalist. I'm going to certainly argue for direct assessment. I do think it's important to do that in a formative and a summative way. In other words, as I mentioned to you, I really believe in using data for continuous improvement. So that formative piece is really critical to have in any kind of early childhood program. But we do want to know in the end, does this work? And again, sometimes that's not just an evidence-based program. It might be an evidence-informed program that we don't yet have the evidence for, but we know might work within a certain cultural group as well. Now, I'm going to say a word about physiologic research. I will tell you, I was a big naysayer of physiologic research with early childhood programs. I thought it was too much of a burden. I thought that families would be against it. I am finding that they are surprisingly willing to do this. Now, the one thing we haven't done, which I will argue against probably till the day I die, is doing hair cortisol with Black families, given what hair means culturally in Black families, but certainly is, as you see in this case, we have started collecting saliva. And I never thought as an African-American researcher, I would even buy into that. But one of the things, and I mentioned this on a call with Phil and Joan and some other colleagues last night, actually, that we're finding that often our parents are reporting low levels of distress, low levels of depression, but when you look closer at the physiologic underpinnings of their behavior, you find that they really do have high rates of stress. So now I've become a believer in thinking about these kind of physiologic kinds of measures. And now that I am a believer, I've started to think about how we can do it in a better way. And we really use that whole relationship issue that Portia was just talking about to convince our families that it's okay. And I'm telling you, we get like 90% of our families agreeing to it. I mean, we do things like show them videos, we show them pictures, we bring out the stuff beforehand, we do the feasibility stuff, all the things that I mentioned. But I will say, you know, unlike I thought, you can get this done in low-income and minority communities. Document review, important obviously for any early childhood program. And then the last thing I just want to say is really thinking about expanding our measurement toolbox to think about some culturally specific kinds of things. For example, I've been really impressed by people like Dee Bigfoot and other people around the country who are doing amazing work with Native American populations, using cultural artifacts from that particular Native American tribe or something like that. So using things like Native American talking circles, best kind of focus group in the world, you know, to kind of learn about, you know, how a community thinks and feels. But the other example I wanted to bring up, I have a colleague in the School of Public Health at the University of Maryland who is doing amazing intervention and research work in the African-American community. And he has had this whole emphasis on using barbershops to not only educate men about health. He's a public health person, so he's doing COVID work and he's doing all this amazing work on hypertension and prostate disease and all these kinds of things that are at high rates in African-American male communities. But he's using the barbershop as a place to collect data as well, sort of using the kind of talk that goes on and doing verbatim reports of what the talk is about COVID or about prostate disease or about hypertension, and using that to document the perceptions of African-American males. So just thinking about ways that are more akin to cultural norms and processes that might give us much richer data than our little questionnaires that people just, kind of go through and just fill in whatever they can to get us out their house. Okay, go on to the next slide. I do want to say a little bit about what I think is important for measurement to be like. Obviously, one of the things we have to think hard about, and I say this to our community partners all the time, is what do you want to know? What do you want to know? If you want to know how a child looks compared to, the national norms, that's one question. If you want to know about growth in your kids, that's another question. If you want to know whether the work that you've done with families results in child outcomes, that's another question. And what we try to help them think about is their theory of change, which is something we talk about a lot in evaluation research. What's the program's theory of change? What do you want to accomplish? And then to try and make the measurement help you to address that question. So that takes some thinking and some time. So I just wanted to put that out there. Is the data useful for continuous improvement? As I've mentioned, we want to make sure that we're doing these kind of formative assessments that allow programs to make a shift, like they've talked often about this rapid cycle stuff. I mean, it doesn't have to even be that fancy, but it could be, okay, this isn't working. Can we change midstream? And to be honest, oftentimes our standardized measures don't really help us answer those kinds of questions. So we might have to dig a little bit deeper and adapt some questions or use a different kind of modality. Obviously, we want to think about, can we use these measures over time? From the evaluation perspective, you need to do a pre-post or nobody's going to pay any attention to you, right? So you have to think about that. But obviously also, if you're thinking about young children, you want to look at their development over time. And I'll be honest, one of the biggest mistakes in a project that I worked on, actually two, wasn't mine itself, but one of these big projects, was where they used a measure for kids up to 2. They were trying to follow kids to 5, and they had to change measurement. So that has lots of implications for what you can say about development over time, but it also has implications for you being able to say whether your intervention works. So really thinking very carefully about, does this help us create a story that will allow us to tell that an intervention worked and that kids grew over time? And then the other thing I'll say quickly is about really trying to understand not just one behavior, but behaviors in context. Like, one of the things that we know very well in developmental research is behavior problems do not look the same in different contexts. So children can look great at school and be what's at home, or vice versa. So we have to really think about the context that really creates the situation that pulls for certain kinds of behaviors, and be able to look at that head on. And the other thing I'll say, is important for us to think about these relationships as well that go on. What happens between a caregiver and a child in the classroom tells us more about that kid's capacity to self-regulate than where he is on a behavior problem scale. So again, arguing for looking more in a more sophisticated way as how children respond to caregivers. That's the whole thing about little kids. They need scaffolding of a caregiver. So it helps us to learn a lot more, to think about it from a Vygotskian term, to think about how these children are responding to contextual issues instead of these kind of singular ways that we ask those kinds of questions. Okay, next slide. I do want to, again, Tyson, I'm sorry, but I'm going to say a word about psychometrics. Obviously, we want them to be reliable so that you're telling the same story across people and time and across questions. And we want to make sure that they are valid. In other words, is what we learn a true representation of what we're supposed to be learning by the measurement tool that we're using? So, okay, we know that it's something that's been talked about ad infinitum, ad nauseum in developmental research, certainly, but the question we haven't asked as much is what the psychometrics are among under-researched, underrepresented groups. Now, there are some measures. For example, again, I'm not advocating any particular measure, but the preschool language scale, for example, has some items on it where you can consider African American vernacular, right? They're never used. They're never used. People don't talk about them. When you read a study, they just say PLS. You don't hear that they've included this kind of thing. That's the kind of thing that we could advocate for. You all were talking about language and African American children. There is that kind of measure that exists, but we don't use it very much. We don't use it very much. Similarly, you all were talking about Latina children. I mean, we have started using the ROWPVT, because we've been convinced by the dual language learning people that you should not be just assessing Spanish speaking children in Spanish, nor should you be just assessing them in English, because they're learning academic things, academic vocabulary in preschool, and they're talking to their mommies and daddies and grandmommies at home in Spanish. So you really need something that allows you to account for all those different things. So we've started using that in our studies with Latino children. So the point being that you need to understand whether the measures are reliable and valid among different populations, and whether they've been standardized among different populations, including whatever population you're working with, low-income families in general, and whether they're part of the measures have been used with specific cultural groups. Now, one other thing I will say about this issue with target population, you need to make sure that the measures are feasible with a population in terms of how long it takes to administer, right? We've had a lot of children that just said to us, leave me alone, I'm done with this, I don't care, close your PPVT box or whatever, right? So we have to really look at feasibility, which again argues for some good pilot work. Not only in terms of time, but language that it's in. You know, does it make sense, again, to do Spanish speaking children just in Spanish or just in English, or should you do a combination? The format of the measure, the setting, the ease of administration, and obviously all that has important implications, not just for the population whom you're assessing, but what kind of agency you're in. To ask somebody who works in a childcare program to be able to do all this kind of stuff. And we're trying to think about it in the era of COVID, when we can't get into some of our centers, what's reasonable for us to ask a childcare provider to do, or an early childhood teacher to do, to help us get some of these data, right? We have to think about all these things. And the other thing that we're starting to increasingly think about is, can we have these measures vetted by the community? So in a new project we're doing where we're looking at perinatal processes, we have created a community advisory board that not only has, you know, researchers and people from these big agencies, but a lot of people from these small community-based agencies and organizations, and we are running the measures by them. Now, again, we have a certain knowledge base as researchers. We can't throw the baby out with the bathwater, but we are saying to them, do you think this question will work? Particularly if we're a little worried about the question. Do you think physiologic data collection will work? So they are really vetting for us some of the measurement strategies that we're trying to use. And I would certainly argue for that. Okay, next slide. I also think it's important to think about who you have measuring. And if anybody knows me, knows that that's a picture of me sitting on the floor trying to show my infant development undergraduate students how to do a Bailey of a very young child. Who happens to be a Latino child of an RA, actually. So certainly thinking about who your measurer is and are they representative of the population. Okay, next slide, and then I'm gonna close. So there are a lot of challenges for us. Certainly many of those have been mentioned before: virtual data collection, high stakes use of measurement, testing bias, all those kinds of things which have been mentioned. Next slide. And others like our limited repertoire of measures for family, which Portia talked about, the feasibility and affordability issue. And of course, as I've mentioned, the inadequate examination of these social and racial justice issues like implicit bias, inequities, and perceptions of discrimination. So these are challenges. And I'll close by making some recommendations. Next slide. So my recommendations are, one, that we try to engage in community engaged research and measurement development, where we have folks in the community much more involved in the decision-making we have about methods as well as particular measures. We try to really think about continuous improvement as an essential part of what we are doing as researchers. We're trying to come up with measurements to create proof points. And I'll tell you, I took this from my colleague who's running our Educare program with whom we work. Programs want to know how we can help them with measures that'll show others, stakeholders, the value of what they do. Obviously, we got to think about virtual approaches to measurement, which we're doing now. We're giving the PPVT over Zoom. And thinking about broader examination of child outcomes, particularly beyond behavior problems, self-report. And final slide, next final slide, thinking about standardizing measures on target populations, thinking about expansion of center, family, and home-based quality measures, because we have a lot to do in terms of that. Aligning quality measures with whatever curricula we're using, whether it's in home visiting or in center-based programming, and then the use of a social justice lens, not only for our questions, but measure creation, standardization, and implementation. So with that, I'll close. If there's any time for questions, I'm able to answer some.
Thank you, Brenda, so much. We really appreciate your talk. And I am glad you talked about psychometrics a little bit there, especially in relation to the community in which you're collecting the information on. We've definitely found that in our review of measures, something that some measures have done a good job, but for the majority that hasn't been considered within the validation of the measure itself. So we're actually going to just take a very short break. We'll probably start up at about 12, let's say 12:42, 12:43, and we'll turn it back to Dr. Phil Fisher to close out. Thank you again, Brenda. started, and we're going to close the session today with coming back to where we started with Dr. Phil Fisher, who will do some closing remarks and future directions, VC Prism. Phil, I'll turn it over to you.
Thanks, Tyson. And I'm again going to make my remarks brief. I appreciate everybody for hanging in there with us. And I actually, I'm just going to ask Tyson and the rest of the team if, after I'm done with my remarks, if you would just briefly go back to the overview of impact and what it's going to look like, because I think in tying things up, it's really important to not just say, okay, we've kind of gotten to this point and gotten this incredible amount of really important input from our speakers today, but also that this is what we're pointing towards in terms of what's going to be happening. So I'll say a few things, and then Tyson, if you want to just go back through those slides, that would be terrific as our sort of final part of this. There was a question in the chat earlier that really forms the substance of what I want to say. First of all, I really do believe that we're entering a new era around what we mean by measurement and evaluation, how we construe evidence, and the voices that we heard today are part of a larger growing kind of sense of sentiments that that we're at a point of critical evolution for the field. And I think that's extremely exciting. And I think we're poised with a recognition of the limitations of what's come before to really make progress in the immediate future, not just in the long term. What I think it's going to take to get there is really the idea that this is an evolution and not necessarily by any means a revolution. And what I mean by that is that often when we talk about how we're thinking about the next phase for the field of early childhood, it may sound like what we're doing is throwing the proverbial baby out with the bathwater when it comes to how we think about evidence and measurement. I don't think that that's the case. As I said previously, I think that randomized clinical trials that are theory-driven and have very clear conceptual models where we use essentially the evaluation methodology as mechanism experiments, that is to really understand the moving parts, is the best way ultimately to be able to discern what works for whom and why, in the right context and under the right conditions. And so I'm hoping that all that we've said and all that we're headed towards in terms of the VC Prism kind of framework is perceived as an extension of the field rather than as a sort of replacement of the field. The issue from the way we see it is that there's been a tremendous gap between what we consider to be practice-based evidence and what we would consider to be evidence-based practice. And the only way that we're going to make progress, especially in ways that really grapple appropriately with issues of racial and economic equity and all of the other contextual issues that we've been talking about today, is if we fill in the space between practice-based evidence and evidence-based practice, and in which we consider as valid and simply as a question of understanding the pros and cons of these different approaches, the full continuum of ways that we can construe meaning in the work that we're doing and understand what we mean by impact. The tools that we're developing are designed to occupy that kind of interstitial space. And in the process of doing so, to really transform the process of garnering information so that it's more equitable and so that it's more meaningful. Scott McConnell mentioned in the chat the concept of social validity of measures. And I think many of us who saw that resonated to it. I'm also somewhat amused that some of these concepts that he was alluding to, there was discourse about them in 1968. as my mentor Gig Levine used to say, you know, there's no new ideas. There's only really good recycled old ideas. I think we're at a place where these issues now have the greatest potential that they had, at least in my professional career, to really accelerate forward. And so we are eager to be part of that. And I really just want to welcome and encourage everybody else who's participating in this, regardless of where you are in the early childhood ecosystem, whether you're a researcher, whether you're a practitioner, whether you're a program developer, or whether you're a funder, whether you're a policymaker or an advocate. There is a role for all of us in changing the supply and demand equations that have really existed in this field that will make it possible to really achieve what all of us, I think, are hoping we can aspire to in this next generation. So I've been just so pleased by the quality of the conversation today, by the incredible presentations of our panelists and our keynotes. I really want to express my gratitude to everyone, to Joan Lombardi for moderating, again, to our funders who have supported this work. We are incredibly grateful and excited about the next phase, and we encourage you all to stay tuned for the launch of the Impact Repository, which, as I mentioned, will be coming up in January. Please share information about the Impact Repository's launch with your peers and colleagues, and please give us feedback, not only about today's presentation, but also more importantly, when the repository is launched, please let us know what's missing, what it needs, what you need in order to achieve the work that you so feel committed to doing. Because this is really a tool that's designed for the use of the field, and we want it to be of optimum utility for all who seek to use it. So Tyson, let me pass the baton back to you. Also express my gratitude to you and to the team, especially all the folks behind the scenes who have made this 3 hours go by in a flash and operate so smoothly. Really lots of, as always, lots of things that you don't see go into successful presentation. So thanks to all of you. And Tyson, now back to you. If you're okay, just going through a quick recap of what the repository will look like and what it will have, I think that would be a great way to end this.
Great, yeah, and if we could pull up those slides if it's possible. Otherwise, I'm happy to kind of just talk through them again. Go ahead to the next slide. And one more, and I'll kind of end here, because I think this thinking through the way that we are quantifying these various aspects and in various domains that we talked about today it would be a great way to end. So one area that came up, well, I'll start with those that we traditionally think of when we think of measurement, which is technical merit, which is reliability, validity of measures in a very general sort of way, irrespective of community and context. And community, we can define, in this case, linguistic diversity, but also cultural diversity as well. But what we have done in going through and combing through hundreds of measures, and in our first batch of measures that we have scored, we've also included an area of usability, so how pragmatic and practical measures are. That came up today both in a variety of conversations in Portia's keynote as well as Brenda's keynote, that measures just have to be thought of as how easy are they to use, and what is the training required to use those measures. So what we've done is scored measures on how long do they take to administer, the training it is required to administer. What did the scores mean? Are you able to interpret the score right then and there, or do you need to go to a computer and put the scores in? Does it give you actionable information to make a decision? We also see this related, the other aspect that we saw as scoring measures that we've added is cultural relevance, and Scott has mentioned kind of social validity. So when we think of cultural relevance, we have scored measures and to the degree to which they validated the measure with a diverse community, diverse cultural linguistic community, and have described the norming sample appropriately. The second part is, and what we often don't see, is the degree to which those psychometric properties, the technical merit of those measures, are similar. And when we say similar, do they have the same high quality sort of qualities for different communities? And what we see for most measures that this is actually not reported. Even if they've collected a diverse community in the norming sample, oftentimes we just don't even know if it actually works. And this gets back to conversations we've had in providing technical assistance for a number of years. So when practitioners tell us, these questions don't make sense to the community I work with, they don't work. What we learned is actually it's true. When practitioners have told us that, it actually doesn't work from a measurement perspective. The other area, which is cost. So we've also been scoring just how expensive measures are and the degree to which measures are free at low cost or require some sort of subscription fee or something like that. And taken together, what we really see is a value, and based on our conversation, is that we need to kind of move beyond this, just find, one measure and really begin thinking of what's the context, what's the purpose of measurement? Is it for practitioners? Is it for improvement? Is it for accountability? And from there, weigh the various criteria in meaningful ways so that we can improve the decision-making process on the information that we're collecting and improve the quality of that information and begin to make better decisions in a way and begin to think through and advocate for children and families based on the information that we're seeing in a way that's equitable across communities. So I think what I'll do is just kind of close here. I know just a few minutes early, but I do know it's kind of been a long time. Again, I just want to say, as Phil mentioned, thank you to all the presenters and panelists for the conversation today. And I hope the time today was useful and productive. To me, it very much was, and I learned a lot from everyone. We will have this presentation as a recording that we'll be able to share with all attendees. And we look forward. Please reach out to us, ask questions if you want to connect, comment, give us advice and feedback, and hopefully we can continue the conversation from there. All right, thank you all.